hematology, oncology, coagulation disorders. All right, so for coagulation disorders, what we first need to go over is how can we test these coagulation disorders? And it's very high yield to understand the tests that they use in order to track what's going on with our blood and our coagulation factors. I've touched on this a little bit before, but I want to make sure that this is clear. So first we have PT. PT just tests the function of our extrinsic pathway. And we know that that extrinsic pathway is going to denote PT because we play tennis, PT, outside. Hence, we're going to have extrinsic pathway. Okay. And that's mainly going to denote us thinking about factor 7, right? Because factor 7 is one of the main ones that we care about in the extrinsic pathway. PT, INR usually go hand in hand. There really isn't much that you need to know about INR except for the fact that normal is usually about 1, and then anything that's greater than 1 is prolonged. And warfarin is really what is going to prolong that PT, INR. Next is PTT. This is going to be a signal for our intrinsic pathway. So any defect in the PTT pathway, so the intrinsic pathway, we know it's associated with PTT because we play table tennis inside for intrinsic. And that's going to be any of our tenet factors, right? So 12, 11, 9, 8, or 10. Well, 10's both, but 12, 11, 9, or 8, okay? So be aware of that, and you'll be able to get it right. Next is just going to be bleeding time. If you see any prolongation of bleeding time, then you know that you're going to be dealing with something wrong with the platelets rather than any of the factors. And then platelet count. The platelet count is just going to tell you if you're using platelets excessively or if there's any autoimmune destruction of platelets themselves.